Welcome to Concussion, the podcast that dives deep into the world of brain trauma, breakthrough treatments, and inspiring recovery stories. Let's get into it. Hey, what's up, Ab? How are you doing?
I'm doing well. How are you, Travis?
Oh, great. I mean, it's been a heck of a day. It's crazy weather we're having.
Yeah.
It was cold last week, and now...
Here's summer.
Yeah, and summer's just smacked us right in the face. Boom.
No
Crazy.
transition.
But okay, so hey everybody, how you doing? Welcome to Concussion. I'm Travis. I crashed my motorcycle 9 years ago and got a TBI, diffused axonal injury, was in a coma for 11 days, the whole 9 yards. And this is Abby.
And I'm a physical therapist. I'm very passionate about concussion recovery, from accidents such as what Travis has had to injured athletes. And we are teaming up to go through what others can find as a resource, whether you've had a concussion, know somebody who's had one, or just want to learn more about them. And today we are going through common myths regarding concussions.
Myth busted.
Myth busted. We have several to go through because there's a lot of misconceptions about concussions.
There is.
So even just on our own journeys, we've busted our own myths along the way. So it'll be interesting to go through.
Yeah, for sure. And I know the one thing that I talked to you about, and I don't know if this was on our myth. It might be. I'll just hold it for the end.
Okay.
And if we don't talk about it, I'll bring it up.
Okay.
All right. So our list begins.
Our first on the batting order. You have to lose consciousness for it to be a concussion. Is that a fact or myth?
That is 100% myth. You do not have to lose consciousness to have a concussion.
Mm-hmm. In fact, it's far more common to have a concussion with no loss of consciousness.
Yeah,
so that's one that's important to distinguish, because especially for folks that have that mentality of if your eyes are open and you're talking, you're fine. It's important to know that someone doesn't have to be unconscious for them to have injured their brain.
Yeah, absolutely.
Yeah. So that one, believe it or not, still does come up in the clinic. Oftentimes I'm hearing that from parents or coaches, folks in different roles where they see a collision or an accident happen. And then a couple weeks later, when that person's still not right and they're seeking care, they always hear, but he never lost consciousness.
He never passed out.
Yep. He was awake the whole time. Now, here's a piggyback on that one.
Okay.
Do you remember, because this was something that was conveyed to me, so it might have been for you as well, that after somebody hits their head, don't let them fall asleep.
Yeah, I heard that. Like, can't fall asleep or they won't wake up.
Yeah.
Is that true?
That's not true.
That's not true.
That's not true. You should always take them to seek medical care for that to be determined from a medical professional as to the condition of their brain. But that's something that was passed along through generations of misconception, because someone who did hit their head probably did fall asleep somewhere along the line. The swelling of their brain likely was the source of whatever demise they came to. But if you hit your head, it is not a steadfast rule that you can't go to sleep. But if you're ever in question, go seek medical care first. But I do remember that was something that was passed along, even to me, that was a rule. But that, in fact, is not a rule necessarily.
Yeah, I remember when I was a kid, my mom told me that. She's like, if you get a concussion, you can't fall asleep.
But like, does that mean you stay awake forever?
That'll be it for you. Forever. I'm still awake from the time I hit my head when I was 4.
There was no end to that. Like, the recommendation was, if you hit your head, just don't fall asleep. But no one ever said for how long.
Right.
Was there a solution? Like, well, we never let them sleep. We never have to find out if this was actually a concussion or not. But meanwhile, they got psychosis because they've been awake for 5 days.
Right. We've had patients awake for 7 days now. Like,
We still don't know.
that's not right. Yeah, you can't do that. Like, so you don't have to lose consciousness. And if you're tired, it's probably not going to be, you can fall asleep.
But the caveat to that is if you are ever uncertain about that, go see a doctor. We'll revisit that part of going to visit a doctor. But if you're in that position where you know somebody hit their head hard enough that you're concerned that if they fall asleep, they won't wake up, don't follow the myth. Just go get them checked out somewhere so someone can tell you for certain it's okay for them to fall asleep.
Gotcha.
Yeah.
So myth number 1. If you hit your head and you get a concussion, you will get knocked out. That is fake news. That is false.
It's false.
That is a myth.
You do not have to lose consciousness to have a concussion. The next one we have here.
Number 2.
When your symptoms go away, you're better.
When your symptoms go away, you're fine.
Yep.
The concussion is over.
Is that fact or myth?
That's myth.
Yeah.
That's myth 100%. Because, it's like my symptoms of a concussion, I would say, are gone. But, man, you still struggle with these, day-to-day issues.
Because keep in mind, symptoms are thought of as what happens initially. Vomiting, headache, dizziness, like staggering, off balance. Once those symptoms go away, it might indicate that just the initial phases of the swelling or the chemical changes after a concussion might have subsided. But I know we've covered on this podcast before that even in concussion protocols, so when someone is now able to run without a headache or nausea, or they're able to hold their balance, or they're able to repeat 3 words, those things in isolation might be fine. But we know that the brain is a multitasker. So even if those things get better in isolation, it doesn't necessarily mean that everything's better for you to go back to a high demand job or a high demand sport, because we have to make sure the brain has met the demands of what it's going to be asked to do in those conditions. So
right,
those...
Because
go ahead.
It would probably be almost impossible to fully comprehend, fully get a full scale of what the brain goes through in a day in a single test, because you're kind of doing, maybe a single solitary thing or maybe 1 or 2 things, but driving to work and then working all day, or like Christy last week, she's dealing with 15 kids.
More than that, 30 probably.
Right. Yeah. It's, there's going to be a lot more contributing factors that may, what would you say?
That may challenge the brain in a different way.
Right. Yeah. You're going to, the more tasks you add, the more it stresses the brain out.
The more demands there are. Yep. And I actually have used the term that she introduced me to last week, microdecisions.
Microdecisions.
I used that today, and somebody was able to identify with it. They were trying to explain to me what happens to them when they're trying to, in this instance, multitask and manage a lot of things, people, tasks, things like that. And they couldn't put their finger on it. And I said, it's like you get tired of making all those microdecisions. And that was perfect for them. That
nice.
was the explanation that they were looking for. So I appreciate her sharing that term with me.
Yeah.
It's a good way to explain it. Okay, so that myth busted. When your symptoms go away, your head is better, or your concussion is healed. That's a myth.
Gotcha.
Yep. Now, another one is concussions have all the same symptoms. So in order for you to have a concussion, that must mean you have light sensitivity, noise sensitivity, and headaches. That's a big misconception that I come across on a regular basis. But as you've explained, certain things bother you a lot more than others, and you might not have any headaches, or you might not have any noise sensitivity. Or in your case, you have a lot of noise sensitivity, a little bit of light sensitivity, but your symptoms aren't going to match the next person.
Right. And I'll be honest, I don't ever remember having a headache. Maybe in like, I do see some hospital notes where it said that I had a headache and they give me whatever they give me. But I don't remember that. But I mean, of course, I don't remember anything for the first, 40 days. I don't remember anything. So maybe I did have headaches, but by the time I was recovered to remember enough, I don't remember having any headaches. So,
yeah.
But I definitely wasn't healed. That's for sure.
And I've had several patients who, even in the early stages, don't have any headaches. And even high-level athletes, some of them will have a very clear head impact, but no headache. But that doesn't necessarily mean that they're not concussed because they don't have a headache. They might experience staggering, loss of balance, and maybe some other cognitive symptoms as well. But all concussions don't come with the same set of symptoms to be able to identify it. So it makes it a little harder to pick out what could be a head injury and what's not.
Yeah, for sure. Like I'm sitting here. I was just reading this yesterday. It's the Diagnostic and Statistical Manual for Mental Disorders because I'm into that type of stuff. And it does it. So there's a lot of mental disorders that have this certain criteria that if your patient is displaying five or more of these specific traits or symptoms, then they can be diagnosed with this mental disorder. So concussions have, since it affects the brain, it has such a wide range of things that could happen. It's almost impossible to nail down just 6 or 7 common symptoms that you could specifically diagnose. Okay, they got this concussion. It's just far too broad of a injury.
Is concussion in the DSM-5?
I don't believe so. No, it's not. No, schizophrenia, PTSD. So PTSD is in there.
There definitely has been a lot more attention to the fact that PTSD can accompany a concussion. I've noticed that more, that patients are coming in with their referring doctor acknowledging that with them, which didn't used to be the case. So I'm glad there's a little bit more attention to the fact that if somebody was in an accident and they were awake the whole time, or even awake for part of the time, the trauma of that accident resulting in the head injury, that experience in itself might warrant its own intervention for PTSD because it might be a scenario that they have to continue to experience.
Oh yeah, absolutely.
Like what if it happened as a car accident? They have to drive through that same intersection every day, once they're healed and back to work and doing all that. And beforehand, the avoidance of driving or the avoidance of that specific place on the road or those conditions was not really acknowledged that that's something that this person might have to work through. Putting people in the right hands of a mental health professional to be able to work through what they're now acknowledging as possible PTSD in addition to the concussion has really made a big difference in the healing journey for a lot of these folks. And I'm glad that that's starting to get tied in. So glad you came across PTSD in the DSM-5.
Yeah. And speaking of mental health, June is Mental Health Awareness Month. And we have a couple of programs going on at work to bring that into light, especially at jobs like mine. That's kind of always on the back page, mental health. Nobody likes to say that, oh man, I'm feeling bad or I'm feeling depressed, but that's a heck of a symptom with concussions is depression. Like you just feel bad. Like that's kind of a weird symptom, right? Like pretty bright and cheery normally. You get a concussion, and now all of a sudden it's like you have no hope, and there's like you don't want to, like, all your beliefs kind of dissipated. Like that's one thing that happened to me, was a pretty good bout of depression, and that still comes on. But you can beat that. You can overcome that. I think one of the things that helped me with that particular symptom was exercising. So I don't know if that's right for everybody, but
yeah, depression, anxiety, and somatization are three very common side effects, I guess is the best way to put that category, with concussions or repetitive head impacts. So that kind of carries its own burden with it.
Yeah, like anxiety. Like I didn't have any anxiety. Like I'm like non-anxious. I'm like the opposite of that. I'm like so cool, calm, collected. But the depression, like that hit me. So I mean, you can definitely see there that's two symptoms that you may or may not have.
Yep. Just because you have a concussion doesn't mean you'll have anxiety. Just because you have a concussion doesn't mean you'll have dizziness or light sensitivity.
Right.
Yep.
Yeah. Does it depend on like what part of the brain that you injure?
In some ways, yes.
Probably complicated.
It's complicated, yeah. But there was a study that was done that's very interesting to me because they looked at over 2,000 NCAA athletes, and their real intention was to see if there was a correlation between neck strength and the integrity of the white matter in the brain. So if the person's neck was stronger, were they able to protect themselves from head impacts and contact sports? And they found that part out, that yes, the stronger the neck is, the more intact the white matter is. But they also found that weakness in certain planes of head movement, so weakness in flexion and right rotation, had a higher correlation with depression scores, and weakness in extension and left rotation had higher somatization scores. And
hold on. Say that again. Weakness in the left rotation. What was that?
So actually, let me get you the facts here. So I'm going to pull up that study so I can tell you. Because the very interesting part to me is that it shows that if the head continues to experience stress in certain directions, that there will be a higher predisposition to experience that psychological symptom. So the study was done in 2021, and they found that if the athletes had a correlation of weakness in flexion and right rotation, they had higher somatization scores. And then if they had weakness in extension and left rotation, they had higher depression scores. So the way they assess that is there's a survey called the Brief Symptom Inventory 18, and it's questions that are meant to assess depression, anxiety, and somatization. But the part that's wild about that is it means that if the head is experiencing repetitive stress or shearing forces in a certain direction, that has a potential connection to that certain psychological symptom.
That's so if I hit, like, say, like the right side of my head all the time.
So not necessarily repeated impacts to that side of your head, but if you imagine in sports, if you're tackled, let's say, and your head is predisposed to going to a certain direction because it's weaker in that direction, that repetitive shearing force could have a correlation to that psychological symptom.
Okay, so, and what was the depression? The left...
Extension and left rotation.
Extension and left rotation is more correlates with the symptom of depression.
For athletes that are in contact sports.
Athletes in contact sports.
Yep.
And that's due to, like, muscle strengthiness in your, in your neck, or... what have you.
So they measured their neck strength just to see if the stronger the neck was, the more protected the brain was. And that part's true.
Yeah, that makes sense.
But they coincidentally found that these correlations also existed of weakness in certain directions were correlated with that psychological symptom that we explained.
Gotcha.
So that means that potentially, as the athlete took contact in their sport, so say it was a tackle in football or collision in lacrosse, if their neck is weaker in that direction, their head is more likely to have shearing forces towards that side of weakness because it's less braced or less stabilized. And that repetitive shearing could relate to that psychological symptom.
Okay. I mean, that's pretty interesting. Has there been any studies done in like non-sports related concussions?
Not for that correlation necessarily, because usually, hopefully, people are not experiencing collisions like that on a repetitive basis. Ready for our next myth here?
All right. So this is myth number 4. Correct?
Yes. Myth number 4.
This is the one I picked out, right?
Almost. Myth number 4. Rest is best.
Oh, that's right. Rest is best.
What do you think about that one?
So, I mean, I like to rest, but I guess, do you think that would depend on how soon after the concussion? Like, I mean, obviously you don't want to like be return completely to exactly what you were doing, 2 days after you get into an accident and get a concussion. So there obviously has to be a little bit of rest, but I think you're going to say rest maybe for a little bit, but you got to get back out there. You got to start exercising your brain a little bit.
Yeah. I'd say strategic rest is best.
Strategic rest is best.
Yeah, if I had to change it instead of completely, throwing that out as no, that's not true. You're right. At first, sometimes with swelling and everything else that's going on, there does need to be a little bit of rest. However, we found that concussions recover a lot faster if the person is experiencing some sort of light cardiovascular stimulus or really participation in physical therapy gets us the fastest recovery. So ideally, if we're seeing a concussion at day 2 or 3, that's where we want to start. And when they come into physical therapy, as you know, we don't have them rest. They might have rest breaks, but we're strategically having them exert, think, balance, move, multitask. So in that way, rest is not best.
Gotcha.
We got to get you on the move.
As a physical therapist, that's physical therapist talk. They want you moving and sorting memory cards and stepping up onto little stools and sitting down and stepping onto those,
We want your brain working.
Yeah.
Yeah. Yeah, the brain desperately needs that stimulus. So putting yourself in a cool, dark room for a week, 2 weeks, we used to call that cocoon therapy. Like, eliminate all this stimulus. Everything that gives you symptoms is bad. Go away from it. Get into a quiet place. But that has been completely dispelled in research now. We know that is not best. In fact, that delays recovery.
Right. I mean, I would say, like, depending on the severity of the concussion. Like, if you were like me, for instance, like I was in a coma for 11 days. So obviously, there I was certainly not out exercising or zero cardio. Man, I didn't do cardio for like months and months, but I couldn't, right? Like I couldn't walk really. So
yeah.
I mean, that's one thing.
Yeah.
But
that's a good point. Like, say, for instance, in your accident, there's injuries elsewhere. Say, for instance, you have a concussion, but you also have a broken leg. You can't get up and walk, right?
Right.
But there's tons of other things that could be done to help stimulate your brain. So there's even movements you could do with your upper body that wouldn't affect your leg. There's concentration-based tasks. There's all sorts of things that you can do because the brain does so much. We just know that the cardiovascular side is so important for being able to release the brain-derived neurotropic factor, for being able to lay the groundwork for the brain to start rewiring. But yeah, that and it's not too long ago that thought of rest is best was followed by many healthcare professionals, because that was what we thought would help the brain heal. Is, well, if it hurts to do this, like gives you a headache or gives you dizziness, don't do it. Keep resting until you can. But it turns out that you're never going to be able to do that thing until your brain is exposed to it in a strategic way to help rebuild that.
Yeah, I guess that's one thing about the medical world. You know, it's constantly evolving, and we're constantly learning new things. You know, I guess that's why they call it a practice. You know, because doctors, they're learning.
So let me ask you this: so let's say something's discovered in research, and it's the very high level of evidence. It's almost taken as now fact. It's a very certain thing that was discovered in medical research. How long do you think it takes for that new discovery to change the way doctors do things?
So I would say if it is anything like how fast the government works, I've worked for the government for years, for like over 20 years. If it is anything at the pace at the government operates, then extremely slowly.
How many years would you guess? Like, say, for instance, we figure out in research that, let me give a good example here, that prescribing this pill prevents, let's say it prevents type 2 diabetes if somebody has this indicator in their blood work. So doctors reviewing their blood work, they see some indicator that would mean that this person is likely to develop diabetes. And research was just completed this month in June of 2025 that says if we prescribe this pill, and this is again very, very hypothetical because there is no magical pill, there's going to be side effects, there's a lot of things. But let's say that this pill was studied and they figured out there's no side effects, there's no long-term consequences of being on this pill. But if you prescribe it when somebody has this indicator in their blood work, it 100% will prevent the development of type 2 diabetes. How long do you think it would take for that discovery to relate to doctors prescribing that to their patients with that indicator in their blood work?
I would like to hope that it would be like a couple weeks. Like, oh, we got to get this out. This is important. Everybody's got to know. And it would be like a beeline.
Okay. Now, you gave the example of working for the government, change is slow. So keeping that in mind, what's your more conservative guess for how long it would take for this discovery in June of 2025 to change the way doctors prescribe or treat this certain condition?
I would have to say June 2026, like a year.
Okay. So it's 16 to 18 years.
Come on.
Between when, and this was released by the National Institute of Health. So this is the big governing body that releases all these funds for all of this research. And they said that the knowledge translation gap, so how long it takes between the time something's discovered till when it changes practice, is more than a decade and a half.
So how many people suffer because of that? Because of
and why
how
is
slow?
Why does it take that long?
Why does it take that long?
If you think about it, information is now more accessible than it's ever been.
Oh, yeah.
So if I wanted to know something, I could look it up and find it within seconds versus 20 years ago. Yeah, versus 20 years ago, I'd have to go to the library, find the card catalog, it'll give me a certain number and the the codes for how they use that Dewey Decimal System. Is that what it was in the library?
The Dewey Decimal System.
I had to go find that section, open up each book that it told me would possibly include information on that. And I'm limited to what was published, what was available at the time that that book was published. That book could have been published 5 or 10 years ago. They're only going to have information that was available up until that point. So back then, that kind of makes sense to me as to why that knowledge translation gap was so long. But
So
nowadays, that's not the case. What's that?
Right, like now they're talking like that, like with
So
Google?
so this is another good example of how this transpires. I think the National Institute of Health published that in like 2019 or 2020. So even that stat's outdated. So there could be, something else that is repeated and looked at this again, and it might find that it's 12 years now or 14 years. But the article that I read was based on what was available when it was published. Yeah. So that's a good example as to why this knowledge translation gap is so significant and why it's very challenging for anybody in the healthcare field to truly be on top of it. It takes a conscious effort to keep yourself up to date because research is being published every single day.
Well, that's kind of crazy because, like, what if they find out that there was also a negative side effect that we overlooked, and it makes all your hair fall out. Mm-hmm. And then people start taking this medication, and they knew all the times technically they knew when people started taking it, like all their hair is going to fall out, but the information just wasn't there. It just doesn't move fast enough. Isn't there like databases that I could go and like punch in and be like, what's the best?
The best database?
Or, I can ask the database, like, what medicine do I need to take? Like,
it's not quite that simple for them to say, what's the best thing to treat this? They more so would have to look specifically into like that drug that they're considering and the side effects and all that. But all to say that gap of time between when something's discovered and when something's implemented, that's really important to know as a consumer of healthcare. So everybody in the world is a consumer of healthcare. That's important to know because when you're seeking care, you have to keep in mind that it's up to what that practitioner knows at that point in time.
Right.
That could change day by day.
Wow. I mean, yeah, especially nowadays with how fast medicine is updated. Like, I know that they're using artificial intelligence now to do a lot of medical stuff, and I guess maybe that'll make things operate faster.
Maybe. We'll see.
If it's anything like the government, it will make it worse.
It'll make it slower. It'll make us question ourselves more, and then we'll be more hesitant to follow any sort of research or discoveries in that way.
Yeah.
Yeah. But that's kind of that fact just stood out with me quite a bit because it reinforces the responsibility you have if you're licensed in the healthcare field. It's not, I got my degree, I'm done. Otherwise, you are treating people with only the information that was available the year you graduated. And you're doing a tremendous disservice 5 years out, 10 years out, 15 years out, if you're not actively consuming continuing education, research, getting involved in that way. So it's a very real responsibility that I hope a lot of people who are, getting into the healthcare field take very seriously because that requirement to maintain your license of participating in continuing education, it's put there for a reason. And if you're doing it in just a passive way of like just the easiest credits or going to a conference but not actually attending it or learning anything, you're going to be stuck in that archaic time of only being able to help people based on what was available when you went to school in the year that you graduated. But it changes on a constant basis.
Yeah, probably. And it's probably going to start changing a lot faster with these different, so one of the things that I seen, speaking of like biomarkers, a recent study, there was an a study done where somebody indicated that there were certain blood biomarkers that could indicate a concussion. So you could like get a blood test for a concussion.
Mm-hmm. Yep.
And I can't remember exactly what blood biomarker. Like I have it in ChatGPT because I was asking ChatGPT about it. And that seemed pretty interesting. That seemed like pretty new information.
Yeah. Mm-hmm. So the trouble is, say for instance, that was already been thoroughly researched, discovered, done. It's science now. How do you get to the point where you're at a soccer field and a 14-year-old hits her head and you want to know if they have a concussion? You don't have those resources at your disposal, nor does the closest emergency room or primary care doctor or whatever else. So then that's the second battle of, if we have this technology and we have this science, how is it accessible to people that need it? Or to someone who gets in a car accident, police officer shows up on the scene, gets them loaded up in the ambulance, sends them to the emergency room. That emergency room probably does not have the technology needed to be able to detect that biomarker.
Yeah,
so that's another
sense.
battle, the infrastructure that it takes to be able to get these devices and technologies accessible to those that would need them.
Yeah, or even to know about the test, because I'm sure there's people that don't know about those blood biomarker tests yet. There's probably doctors that don't know about them.
Probably. You're right. So we have two more myths. And I'm actually going to change the order of them because we are just right on the cusp of the next one. But yeah, these are the two that you brought up.
I was thinking the same thing. And that's
the next one of all doctors understand concussions.
Yeah, that's definitely a myth. I mean, look, doctors are great. I love doctors, but man, you can't know everything about everything. You know? I mean, come on. Like my MS doctor, Dr. Silverstein, he straight up told me, he's like, look, he says, I'm not a concussion doctor, Trav. Like, if you want to see a concussion doctor and talk about that, he's like, if you want to talk about your concussion, you should see a concussion neurologist, not an MS neurologist. Like, I'll tell you all about MS, but concussions, not my specialty.
Dr. Silverstein deserves a round of applause.
He's great.
I mean, that's really what doctors should do. Like, if there are, because the reason he is so special for saying this, because he's a neurologist. And a lot of times you assume, like, if you're a neurologist, you know about nerves, the brain, you should be able to handle this. But there's so many different areas in neurology, and he chose to specialize in autoimmune and MS, and he knows a lot about MS. But it's so noble of him to straight up tell you, I'm not your guy.
Yeah.
I can get you connected with somebody, but that's not me.
Exactly.
So that's really powerful when a doctor's willing to tell you, I'm not the best person to help you, but I'm going to get you to the best person to help you. Because I can tell you for certain that there are other neurologists that may not say that. And that's really a shame because let's say they deal with a caseload of Parkinson's and dementia or other neurodegenerative diseases, and somebody comes along with a concussion, they figure, well, that's still in my wheelhouse, and they try to manage it. It might not be the best care or the most evidence-based current research that this doctor's using to treat that concussion. They might tell that person, go home and rest for 2 weeks. They might tell that person, don't fall asleep. No, I'm just kidding. They wouldn't say that.
I'll tell you. And I run a lot into that at like my work. The guys I work with, believe it or not, they know everything about everything there is. Any question that you could ever have, they are like experts in it and they know the answer. Yeah.
So that same ego could be present in a doctor too.
Right. Yeah. So I'm glad, Dr. Silverstein was like, hey, I'm not your concussion guy. Like that is like, it's nice. When, I guess I've never had a problem like telling people that I don't know. Like there's a ton of stuff that I don't know. Like there's some stuff that I'm pretty good at. Mm-hmm. And I will certainly offer my opinion on those things that I'm good at. But if I don't know, like I've never been afraid to say, man, I don't know. And usually that's what I'm saying. Like, I don't know.
Yeah.
Because I don't.
Know what you don't know, right?
Exactly.
Yeah. So that is a myth. Not all doctors understand concussions. Not all doctors manage concussions. So in other words, not all doctors can diagnose or treat a concussion.
Right. So just don't.
So, sorry?
No, just don't go see some random doctor about your concussion.
Even if you go see your doctor, but there's your doctor for managing your medications or managing your back pain, and you bring up, I hit my head, things don't feel right, I'm off, this stuff is hard for me, never used to be, and they tell you, it'll go away.
Yeah.
Or rest and then get back into what you're doing. If it doesn't feel right, you have to keep going to find a doctor or a practitioner that's going to understand what you're saying. That was Christy's main point, is if you don't advocate for yourself, you're going to accept whatever you're told and be stuck with whatever you have. So being able to speak up for yourself in the healthcare setting is a very important skill, and especially when it comes to concussions.
Yeah, for sure.
Because it's not something in the DSM-5 where we have this list of inclusion criteria of, oh, this is what it is and this is what we do. It has to be with a very high concussion IQ doctor. That's how I've been referring to them. And thankfully, Christy's primary care doctor is phenomenal, has a very, very high concussion IQ, so I was able to get her treated almost immediately.
That's awesome. And we'll be interviewing a concussion specialist doctor the end of July, correct?
Yes, that'll be an awesome conversation. He's just been such a pioneer in concussion management. He was doing this long before anyone else that I know of, and really had to fight the fight of educating people, everyone, doctors alongside of him, physical therapists, everybody. He had to herd this group of folks that just didn't know what they didn't know, and kind of lead them towards, this is what we need to be doing. This is how we care for these patients. This is what we need to have them doing. This is how we assess them. This is how we know if they're getting better. These are the stimulus that's going to get this part better. He's really been kind of on the front lines of getting people more aware of concussions for over, oh gosh, how long has he been in practice? Well over a decade, but I think it's more towards 2 decades. So I'm excited to ask him some questions and get his insight, because he's just got such a wealth of knowledge that we can learn from.
Yeah, I'm pretty excited about that. And he'll probably be able to answer a lot of questions, and he's probably pretty fluent in talking about concussion. So he'll be a great guest. Yep.
He's very, very good at explaining them and making all this more relatable and easier to digest, because concussions are complicated. But you're right, he can talk about them in a way that makes it more approachable.
Nice. Maybe did you tell him about our Jello brain, that we couldn't get the Jello?
Did not tell him about our Jello brain. Our Jello brain doesn't exist yet. We were defeated by the Jello.
Dude, I don't know what happened with that, man.
I have 4 more boxes of clear Jello. We got to keep after this.
Why did this Jello not get hard? I was like, what is going on? And my wife is like, you guys can't even make Jello. And I was just like,
we can't, but we'll figure it out.
Yeah, we'll get it.
We intentionally bought a lot of Jello in anticipation of having some challenges. We just didn't know the first challenge would be getting it to become Jello.
Getting the Jello to Jello.
Yeah. Yeah, it's not doing its job right, or we're not doing it right. But either way, I have more. We can keep after it.
Nice. Yeah,
so no, I did not tell him about our lack of Jello brain.
We will make that Jello brain. Yeah. I'm excited. I'm still excited about that.
I know. It's going to be pretty cool once we figure it out. So
once we figure out how to make Jello.
Figure out how to make Jello. Yeah. Yeah. And the funny thing is, it's not hard because college kids do it.
Right.
And I don't think they make peanut butter and jelly sandwiches, but they can make Jello shots. So we're missing something pretty simple here. I think between the two of us, we can figure it out.
Maybe we should put alcohol in.
If that makes it Jell-O, sure. We really have to consult with some experts here as to why we can't figure that out.
Yeah.
All right. So our last myth. You can only get a concussion from hitting your head.
So, for sure, I know that one is fake. That is false. There's you don't have to have like an impact. You know, your head, like your brain, and that's kind of why we're making the Jell-O brain, right? Like this is all tying in. Like your brain kind of sloshes around a little bit inside your skull. So like if you have like a whiplash motion and your brain is still like moving in there.
Yes.
So it doesn't necessarily have to like be traveling at 60 miles an hour and coming to a sudden stop. It is just an unprepared for whiplash motion could cause a head injury, or maybe even a prepared for.
There you go. I was going to say, I had an eval today for someone who had a head-on collision. He saw it coming and braced. Didn't hit his head on anything, but definitely felt himself whip forward and back. So that's a perfect example for what you're saying.
And it's funny that we're ending on that one, because today I was talking to a guy over the internet, and he sends me an image, or he tells me that he got a concussion or a traumatic brain injury, and he sent me a video of what he was doing, and he was riding on a rib boat. He was in the military, and a rib boat is a rigid hull inflatable boat. There's all kinds of different there's different variants of that boat, and they ride around in very rough waters and rough seas. And the guys in them, because I know this because, like I said, I have been in these boats. Again, I haven't been in the military, but I've been in like rib boats, and they go approximately 40, 45 knots.
Wow, that's pretty quick.
Yeah, that's pretty quick. So that's like a little over 50 miles an hour, and they can kind of throw you all over the place. And there's been several people that was riding on the specific rib boat that he was riding on that have these traumatic brain injuries because of that whiplash motion of getting beat around on a boat, and just your head just jostling around all the time.
Yep.
And he actually told me that the military is doing studies and specific studies on what happens when people are placed in that scenario and how much brain injury do they get. And the military, they do all kinds of studies all the time, and they have everybody who joined the military, they have all their health records from the time they started until now, and they have very specific, detailed records for them. There's like I said, they're starting to do these studies of these guys, not just people on these boats, these rib boats and these things where their heads jostled all around, but they're also doing research on pilots that fly, very fast jets that take off and come to sudden stops. Like when you land on an aircraft carrier, you're going, pretty fast when you land. It stops. It's got to stop you very quickly. So it catches on to like a wire, and you come to a sudden stop. Like you were just saying that the guy was in, the car accident, prepared for it. And I'm sure those pilots prepare for it, but you can't prepare that brain movement inside because you got no muscles to hold your brain, and then there's physics involved, and, they're traveling however fast they travel. When they land on an aircraft carrier, they stop very, very, very fast. And then all the G-force and all that, I have to look more into that. Just found that out today. So
you do not have to hit your head to get a concussion.
Yeah,
just the movement of your body can be enough to do it if it comes to an abrupt stop.
I wonder how many 80s, 90s headbangers.
Right, I always wondered that too.
I was never a headbanger.
Good.
I never, never.
Good.
I was more like a Nirvana type guy.
Oh, yeah? Well, good. I'm glad you didn't get into the heavy metal headbanging, because there could be some changes there. Yeah.
Never. These are the things you never think of. Like,
Right.
so we have busted. Well, one was like plausible, right? Like the rest, it was kind of like
Rest is best.
rest is best. Like, you may want to consult with your doctor right about that, because if you're in a coma, you don't want to be out there.
Oh,
Yeah,
you're talking about the one that if you hit your head, you can't fall asleep. That was one that is like, that was kind of like an old wives' tale kind of thing that got passed down. But if you're ever concerned about that part, go see a doctor first.
Right.
Yeah. So we got those all covered, and then we will be back next week with a new topic.
Yeah. And I think so. I may look into that study that the guys are doing, and like the military guys and the red boats, and I think that would be real. And so that guy I was talking to, he was like, "Oh man, get a hold of me," and he has a lot of information that he can pass and a lot of contacts, he said, with like maybe the people that are doing these studies.
Oh, cool.
And I think I could probably maybe get them to talk a little bit about it, like what they're trying to do.
All right. Well, we will catch everybody next week. Thanks for listening and tuning in, and we'll catch you all soon.
Thanks for watching, everybody. Today, we've busted some of the biggest myths about concussions, like needing to get knocked out, or that thing your mom told you, don't fall asleep if you get a concussion. The old school idea that rest is always best. We talked about how different every brain injury is and how symptoms could never look the same. How mental health challenges like depression and anxiety can sneak up long after the physical signs fade. Next week, we're diving into a powerful topic. What if it wasn't just one hit? We'll explore how cumulative concussions, like those experienced in youth football, military training, and even daily life, can lead to long-term symptoms, even if no single event ever knocked you out. You won't want to miss it. Hit the subscription button, follow us on Spotify, and if this episode hit home for you, drop a comment below, share your experience. We see you, we hear you, and you're not alone.